We have had Dr. Paul SABA on a few times over the controversy at the Lachine General Hospital, closing down the emergency room, not letting it be open 24/7. Then about a week or so ago, we were hearing Dr. SABA publicly announcing that the MUHC had basically taken him to task for talking about some of this stuff. And then we get a story just literally a day or so ago that says the MUHC is ready to restore things, at least to some degree. It would seem to a large degree, at the Lachine General, and I think a lot of people would recognize that's probably because of all the lobbying for this that Dr. SABA has done. So I guess we consider this a win. Let's find out. Dr. Paul SABA, family physician and healthcare advocate, and he, of course, is the head of the Council of Physicians at the Lachine Hospital, is on the line right now. Dr. SABA, thanks for being here.
Yes, so thank you so much. We do consider it an overall win for the population, for the the West Island, where there's 300,000 people who only have access to Lachine Hospital, and to the Lakeshore. I just want to make a small correction. I was present until January 10th, and I handed off to a great team. They figured after me being there for so long, it was time to have a change of guard, and they're working inside, and I'm working outside. So that's been working great. I was taken to task. They try to remove my license, but the truth always wins out, and I always believe that good deeds outdo bad deeds, and that's I always encourage my children, and I say, you do good, it will benefit not only yourself but everybody else around you.
So you got primarily what you wanted. Did you get everything you wanted here?
No, and I think the points that they're holding out on the MUHC is really necessary for a full community hospital. We were in Quebec City, and on the 25th of April, we were able to get a resolution, as we had a very similar resolution in 2007, to guarantee all services at the hospital. So the MUHC has to respect that resolution. It represents almost 9 million Quebecers, and it was unanimous, and they actually did a stand-up vote, which they do very rarely. That means that even, not only just the opposition, but the government, including the Minister of Health, Dubé, to support us as a full-service community hospital with ambulance service 24/7. So I believe that also had a strong sway in what happened. Why intensive care units? They said, no, we can't give you an intensive. Why an intensive care unit is important because when a patient comes to the emergency room, has a heart attack, pneumonia, or any other serious illness, they need to, once they've been stabilized, they need to be put in a monitoring unit. And there are very few beds available, and that's been our experience. Our unit has been closed for a few years, and they've said transfer, but there's hardly any beds to transfer.
Right.
And our internists, for example, they got very fed up, and they really have been very discouraged, as well as our ER docs, by this spending all their time trying to transfer when there are no beds. And so they actually are taking care of critically ill patients in the ER. One of the solutions, they figure, well, we will make sure that you don't have to take care of them. We'll close the emergency room to ambulance. That's not a solution. What we need to do is because the Lakeshore and the Vic can often are in LaSalle are over 200% over capacity many times. So we were saying, no, we need to, and if we don't have a full ICU, that means, we're not asking for intensive care like downtown where they do open heart surgery, but a monitoring service. So basically the nurses are there, they're monitoring, it's the nurses doing most of the work, and if they need more oxygen, they need more fluids, the doctor can tell them. The doctor won't necessarily be there inside, they'll just be available, they come in, they do their rounds, and they're there when they need to be there, And since we're a community hospital, we often have our ER docs who are there. They're there 24. They were there 24/7, and they can handle any of those calls. And then you have a doctor who's not monitoring. So if somebody needs to actually be seen with somebody, we don't have residents, but we will be having residents. Everything is building up. I mean, we're ramping up. It made no sense what they were doing. We have a $223 million building project. And we're going to be a training facility for family doctors. So it made no sense what they were doing. It was kind of like, what do you say? a penny wise and a dollar foolish. I know we don't have pennies anymore, but it's basically that.
Dr. SABA, can I come back just to the controversy for a second? I feel like you kind of breezed over the fact that there was a possibility that they would remove your license.
Yes, that's true. It was 13 months. I wrote a 19-page defense, and I had 76 articles of defense, including I had a letter from Legault back in the early 2000s. I worked in the regions, and he said, Dr. SABA, we need community hospitals. I worked there for 5 years. I volunteered on my weekends, and I would fly out there. And finally, my wife said at one point that we had a newborn. Says, you got to stop doing this. I said, okay, So, and he thanked me. He says, we need these hospitals. It's close to the population, or lives would be put at risk. That was the term he used. And Couillard a year later thanked me also because I was working there, and thanked me. And I even had a Queen's Award in 2012 for the Diamond Jubilee for working to save the hospital, the emergency room, and helping healthcare. So, I mean, I had to put all those things that were in a box, and I said, I think I got some letters of appreciation, and I found them, and I put them in my defense. But
this is, what I'm struggling to understand, Dr. SABA, is that you were fighting for the community. You were fighting to keep a hospital that the community needed. What would be the possible justification for removing your license? That part is lost on me.
Yeah, it may no. Usually the college is for if you do harm to a patient and you shouldn't have. It's not just like a side effect of a drug. You've done really something horrible. And so the complaints usually come from the patient. It doesn't come from an administrator. It doesn't come from the MUHC or an administrator. It was very unusual. In fact, it was very unusual. My insurer actually defended me. They said we usually don't defend doctors against non-administrative problems, but they said this is a question of freedom of expression.
Okay.
So the only reason I went public on it was to help other colleagues who were actually being targeted, who had gone public, and one actually called me and thanked me. He said, "Listen, they dropped charges against me. I think your letter helped. You're out speaking out helped." So I always encourage people to speak out. It caused anxiety, obviously, But all it did is push me. When you tell me to be quiet, my wife knows that I talk more, and I wrote more. I spoke more on defending healthcare, and as I've done over the years. And I encourage others not to be afraid. Many times people just throw in the towel and say that you can't fight City Hall. I said, no, you need to. And you're never guaranteed the outcomes, but you need to do it because it's the right thing to do.
Well, then let me ask then to follow up on that. Yes, it's good news to finally have, this be approved by the MUHC to support what it is you wanted in the first place. What does this mean for the average patient at Lachine General?
Okay, well, for the average patient, and Lachine was known for many people didn't know St. Joe's Hospital. I did a search. Even the premier was born there, according to Wikipedia. I don't know how reliable that is. It means that people will get care that's close. They won't have to, the ambulances won't bypass them because they're ramping it up to open the ambulances, which will save lives because studies show whenever there's delays, people. The longer they wait, the more likely they're not going to survive, and actually they criticized me for saying that, but I said it's true. Here are the studies, and I showed it to them. The other thing is when you close a community hospital, and I'm saying completely close, but when you close the emergency room, like closing access, about 30% of people stop getting any care. So those people, if they don't get care and they're sick, that means they have bad outcomes, obviously. So it's good, and also for the West Island because patients who were being bypassing Lachine Hospital and going to other hospitals, they were preventing people from getting care who are trying to get care at the Lakeshore because they're jamming up the waiting times. You have stretchers, your ambulances parking outside trying to get in, and so it's good for everybody: downtown people, Lachine people, to West Island people, LaSalle people. These are the closest hospitals where our patients were being redirected to.
Listen, at the end of the day, this is a win. You're to be congratulated. You were up there championing the cause. So, both of us, we've had a chance to talk to you in the past. Salute you for that. You've done a wonderful job here. And I'm sure to some degree, this is vindication for you as well. So congratulations. And
I thank I thank the political leaders, the mayors of the West Island, the population came out to, the union supported us for, the doctors who stayed, and the nurses and the healthcare workers at Lachine who haven't given up, who haven't abandoned ship. I thank you, the media. I thank you, Aaron, for Natasha, and for all those people who have been interviewing people at Lachine, including myself, to support our hospital.
Dr. SABA, congratulations to you. You get to take a victory lap now. Well done.
Yeah.
Okay. Thank you.
You fought
Dr.
the
Paul
good fight.
SABA over at the Lachine General with good news from the MUHC.